Safe space.
Safe space.
Safe space.
Safe space.
Safe space.
A place where I can be free.
Somewhere I feel like I won't be judged.
My bedroom.
A place without fear.
Hi, and welcome to Safe Space, a podcast for open, honest, and deeply human conversations about mental well-being. I'm your host, Pauline Wanyonyi, and I'm really glad you're here today. As part of this series, we wanted to shine a light on the term high functioning and give a glimpse into what we could possibly miss when using it. Sometimes mental illnesses and mental health struggles are very silent and almost invisible. Someone could still be managing their day-to-day responsibilities and seem pretty normal, and so it can be easy to assume that they're doing just fine. As a result, many people who are struggling go unseen and often also remain unheard. In this episode, you will be hearing from Elizabeth, and she will be sharing her experience navigating depression, grief, and bipolar 2 while pregnant, and how these challenges can often go unseen and unnoticed by many.
My name is Elizabeth. I am 31 years old. I'm a mom to a 4-month-old boy, and I am also a professional coach, and that is a lot about me. So I think I knew I had a lot to do in the 5 months. I think I had 5 months between January and my baby coming. So I knew I had so much I need to accomplish. So I was always on the go. And I think I would only, or rather, it would only be during therapy that I would stop and pause and have time to assess how I am feeling. And I think that's how sometime, let's say in February, I can say I was about 6 months pregnant then. And I think that's when it became so evident, but it had started maybe in January. So I had my job, my employment. I had work I needed to complete and handover I needed to do. And now on top of that, there is a side hustle, right? So my side hustle is the coaching. And so I had just started, or rather I had started opening up to the public. I was doing a course, so I was trying to get certified. I was also trying to start up, meeting people, starting the coaching. And I really wanted to uplift myself professionally and get to a certain level, because I know, or rather statistically, the fact that after you have a baby, you lose a lot. Is it 2 years? You lose 2 years of your professional life. And I think I defined myself a lot by what I do. So maybe because I really didn't take a lot of time to rest. And in reference to being pregnant, you're supposed to rest, and I wasn't doing that. And I was really anxious and putting a lot of pressure on myself. Been in therapy I started in 2020 and then stopped. But then with this particular therapist, I've been seeing her since July of 2023. So that's 2 years, a bit more than 2 years. Oh, and then in therapy. So I was diagnosed with bipolar 2 in 2020. And having been through a number of rough batches, that's now how it led me to just go into therapy and continue doing that. Also, a contribution was my dad passing away. And that time I could not process grief at all. So that was also a contributor to me getting into therapy. The thing about being bipolar 2 is that we are very good at masking or being what's the word? You can work and high functioning. Yes, that's the word. Being very high functioning. So a lot of people don't really see it until you're really, really down. And even hypomania, sometimes it's very hard for people to actually see it. They might just see you as being very productive or very happy. So that living with bipolar, it makes it really hard sometimes that, like in therapy, sometimes I might think, oh, maybe I'm not bipolar too, but then I sit down and look at my past when I was not medicated, and now remembering that, it's like, okay, no, that's not it. So that has been like my life, I would say, since 2020. Because 2020, I think I got my diagnosis, but I'm sure it was there before. It's just that I think in COVID, a lot of things came out because there was time for them to come out. We were also, I don't know if I can say idle, but we were also in our heads as well. Yeah, so that happens. So that's like in 2020, 2021, 2022. I tend to be very high functioning. So by the time that anyone, even myself, notice that there is something wrong, it's usually not necessarily when it's too late, but it's usually like when some things are going really, really wrong. So now in pregnancy, it was actually the same. I was working really hard. I barely took time to do many things. I even had like a whole, to buy list and to do things in terms of the baby. So it, I, I didn't notice it. My therapist did, and I think even the people who are around me the most didn't either. So because I just seemed to be going through life as usual, then no, yeah, then it was really hard for people to notice. I would find myself crying in the shower. I would find myself unable to get out of bed, struggle with sleep, and anxious all the time. So I think now that's when I started realizing as well that no, this is not just normal pregnancy hormones and things. This is different. I was scared. So I was scared because I have experienced depression before, and it was so debilitating. So I was really scared of ending up where I was. So same thing, being unable to get out of bed, crying all the time, just secluding myself, unable to take care of myself completely. I was really scared of going back there. And also because I had so much to do, I felt like I didn't even have the time to be depressed. Maybe easier. Maybe it makes it a little more simpler to ask for help when people can actually see that you're struggling. Because I have experienced somebody or a number of people saying, really, you were going through that, we couldn't tell, right? You seemed fine. And it's really hard to explain that I am struggling when I look fine, right? It's really hard to say I'm depressed when clearly I'm being so productive, right? And so I kind of wish that it was easier to see, but then also if it's easier to see, generally means it's really bad. So I have a therapist and I also see a psychiatrist. So I have been doing that. So those two, I have been seeing them again since 2023. So what happened at that time, now when I was experiencing that depression, what happened is that, but also I've also been medicated since then. So what happened is that my doses changed. So my dose of antidepressants increased, my dose of mood stabilizers increased, and there was also a limit of the number of things they can do, because now in pregnancy they really don't want to, rather they don't really know exactly what the effect of the medication will be, so they didn't really want to risk it and like change to give me anything stronger. So what happened is just they increased the dose and we hoped for the best. There's really not much else. Like I think it helped a bit because it helped me sleep a bit more, and also maybe that's also why I was able to be more productive. I know my therapist like kind of encouraged me to share, but I think it was really, really hard. So even thinking about it made me start crying. Like, even somebody would ask me, how are you? I would just start crying because it's like, I don't know. I don't know what's going on with me and I don't know how to explain it as well. But I did try, because now I couldn't do it out loud. I would like send messages to friends and say, okay, I'm doing well physically, but mentally and emotionally not so much. I don't like, maybe it's just the word resilient. I don't like being told that I am strong, which, yeah, I guess by definition, I think I am. I think I am. I think I am resilient. I think I can be very hardworking, but I don't like that to be my identity because for me it feels like um I like people don't like people are making assumptions that I am okay and I'm not okay. But also it's not their fault because I haven't necessarily said that I'm not okay. So what I learned about myself, or something I guess I've always known, is that I'm very poor at communicating how I feel. And unfortunately, I don't think that has changed. We're working on it though. We might be working on it. We'll get there. Something else that I have learned about myself would be that actually something that has improved. In as much as I say I'm poor at communicating, I can say that I've actually been able to talk, right? Which, I mean, I've been able to share more than I would if you would have asked me to, let's say, a year ago. Even the little that I did share, I feel like, so there's growth, right? So there's growth there. And very good at compartmentalizing. And that, I guess, also that I can sometimes, or a lot of, at least more recently, I'm more comfortable being alone with myself. But going through that period, it was hard. It was hard to be alone with my thoughts, but I think it's also something that I am more like getting more used to. Yeah, I'm allowed to not be okay at times, minimizing my experience, and that's exactly it. Like, because I look strong or I seem to be strong, then I must just be okay, right? So it's not, so even when I try and say this is what's happening, it's like, no, this can't be happening to you because you seem like you're doing well. And something else that I caught at the time is the notion that a lot of women have done it and a lot of women have survived, right? So, all the women have been able to go through this and they've come out okay. So you shouldn't be complaining, right? There is this, because this is my first baby, there's people who have done it 5 times, people have done it 9 times. So it's normal. I think actually that's the main thing. It's not normal, right? And people say every pregnancy is different, but then that also contradicts them also saying that it's been done and people have survived, so you must just survive and you must just go through it quietly. So I had therapy every 2 weeks. So being able to, I think therapy was like a release. So therapy was a point where my therapist used to say that when we start our sessions, I'd always just be happy and we would chat and I would laugh at things. But by the time we were getting to minute 40, I'd be in tears. So I did feel like safe enough in that forum to be able to release, to be able to cry and, have someone hear me and what I'm going through. Something else would be, I have a friend who we started doing weekly updates with each other, right? So this is what I accomplished last week. This is the things that I found difficult, and these are the things I'm happy about, and this is the things I'm looking forward to next week. So we used to do it every Wednesday. So it was just, even instead of me going into my shell, I would always be able to speak to someone, just actually just voice notes, because adulting, it's kind of hard to have those phone calls every week. But we were just sending each other voice notes, and it was really, really helpful. And I think lastly, my gynecologist at some point kind of forced me to take sick leave, just for me to stop and, just stop and just relax. So during that sick leave, well, I was sick leave from like employment, but I wasn't sick leave from my other work. So it really wasn't exactly what she prescribed. But for a few days, for one day, I remember just going out to, I think it's Red Hill Dam, and then there's just like there's the dam itself, and then it's just green, and it was fresh air and sunlight. And I think just that one day, in nature, and I just sat down and I think I played a Lego puzzle, I read my book, I journaled a bit, and that day or that afternoon felt so good, and it really even energized me. And what I can say that I wish I did is that I maybe did it more often. It wasn't that just that one time. In theory, I would love to have another child, right? Not necessarily right now, maybe later, but I am really afraid to go through this again, that I wouldn't, like, it's just, at this point, I'm just at no. I really don't want to do it because I cannot go through that again. It was too difficult. It was too heavy. And now generally that's pregnancy. So in terms of motherhood, I think basically the same, which is to find people who you can talk to, which is really hard though. It's easier said than done. It's hard to actually find these people, right? Especially if, like me, you're not in the same point in life with your friends. But if possible, find people who you can speak to. I have done a few things with this organization called the Mothership Village. So they do a few they have like groups and sessions that you can actually meet other moms, and that's been helpful. And in terms of let's see, anything else to do with motherhood, a lot of things are given to you in theory, right? You need to do this, that, and the other. A lot of things will come at you, and it's overwhelming. And having gone through depression and then finally having it lift, but then also being put on so much pressure afterwards, it was a lot. So what I can say is that my view on motherhood is it's a hard question to answer. My view, has it changed? In a bit, I think I can say I wouldn't limit the number of people you take advice from, even if the person you're cutting out is your mom. No offense, mom. Because so many people will throw so many things at you. And so for me, how these past months, how I have felt, at least recently, how I have felt more at ease is I stick to the advice of the professionals. So my gynecologist, the pediatrician, the nutritionist, the lactation specialist, because I feel like they have, or rather they have the, I don't know if it's experience. It can be both experience and the knowledge, as opposed to people who have only, well, people have different experiences, right? So, and I think like the basics of motherhood probably are still the same, but it has also evolved with time. So the things that they did 20, 30 years ago could still apply, but also they couldn't. So that's why I decided, let me stick to the people who are doing it now, the people who do it for a living rather, and they see so many different things. Because also that gives peace of mind. It's still bringing a bit of, or a lot, it's bringing back a lot of difficult memories. And to some degree, I think I had also just put them in a box. Sorry. I'd also put them in a box and decided that I will look at that box when I am ready but I think what usually happens when I do that is I forget, and then at some point, things that you put in a box, even grief, it always just forces its way out. So I think that being able to do this today and actually encouraging myself to do this today, I feel good that it's helping me, because it's helping me process my emotions and what I felt at that time. And it's in a way allowing me to speak my truth and share my experience in a way that it's not being minimized. Experiences are valid. You are allowed to feel how you're feeling. You're allowed to take a break. And also, pregnancy will not always be beautiful, and it's okay. And it's more than just the physical symptoms, because I think going into it, I had the expectations of the physical, right? So like the morning sickness, your water retention, so your feet swell, your fingers swell, being exhausted as well, the weight gain, of course. And so those are the things I had in mind. And I think because also I'm on psychiatric medication, and because I was allowed to continue my medication through pregnancy, I thought I'd be fine. Like, at least emotionally, I'd be good. And so, yeah, I think that because it caught me so off guard, I would say that it happens and it's okay. I don't think I can say it's normal, because I also hated being told it's normal. Thank you. Thank you for not telling me that I'm resilient. That's been lovely, and I'm happy that I actually came.
Elizabeth spoke about people often telling her that she is resilient whenever she shares her struggles, and how she doesn't like that. And it got me thinking that it is more than enough to sit with someone as they are going through what they are going through, to simply witness their journey and be there for and with them, even if we don't really understand what they're going through, even if we can't relate. Sometimes we rush to tell someone they are resilient and strong because maybe we think it will truly help. But maybe it's also a quick response to avoid our own feelings of discomfort when someone shares their pain with us. Well, that's just a point of reflection, and that brings us to the end of this episode. Thank you to Elizabeth for sharing your story with us. This episode was brought to you by the Artistic Psychologist. We would love to have you as part of our community, so subscribe to this podcast and follow us on our social media platforms. All links are in the episode notes. And finally, I'd like to leave you with a reminder. You're here, you're listening, and that matters. See you next time.